Hi everyone, I am Dr. Amrita Patnaik, oral and maxillofacial surgeon from the team MDSCONQUER. Here is a video of 32 points on amalgam topic, prepared based on NEET as well as AIMS point of view. Now we shall see the first point. Father of amalgam is Dr. Louis Regnard. Point number 2, ADA specification number of amalgam is 1. Point number 3, maximum expansion that can occur in the case of delayed expansion is 400 micrometers per centimeter, that is 4%. Point number 4, the self-sealing ability of low copper amalgam is better than that of high copper amalgam as the rate of corrosion is more in low copper amalgam. The self-sealing material is amalgam, whereas self-healing material is composite. Point number 5, what is an amalgam tattoo? It is nothing but a grey, blue or black area of discoloration on the mucous membrane of the mouth, typically on the lower jaw. It is caused due to the entry of amalgam into the soft tissues. Point number 6, what is an amalgam blue? The hard tissue, that is the tooth discoloration, is caused by the entry of corrosive products into the dentinal tubules, which causes tooth discoloration, that is blue discoloration. Hence it is called as amalgam blue. Point number 7, the condensation pressure of amalgam is 3 to 4 pounds. Point number 8, what is an amalgam cry? Amalgam should be hard enough to offer resistance to carving instrument. Then a scraping or a ringing sound should be heard. It is known as amalgam cry. Point number 10, KO surface angle for amalgam is around 90 degree, that is butt joint. Point number 11, minimum bulk for amalgam restoration is 1.5 mm. Point number 12, depth of amalgam restoration should be around 1.5 to 2 mm. Point number 13, the ideal width for amalgam cavity should be around 1/3 to 1/4 of intercuspal distance in adults, whereas in children it should be around 1/5 of intercuspal distance. Point number 14, minimum amount of marginal tooth structure to be preserved is around 2 mm in molars and 1.6 mm in premolars. Point number 15, reverse curve in occlusal outline is usually created when mesiofacial enamel wall is parallel to enamel rod direction. Point number 16, to avoid pulpal irritation, minimum remaining dentin thickness should be 2 mm. Point number 17, the axiopulpal depth of the proximal box in class 2 cavity is 0.2 to 0.8 mm. Point number 18, gingivally the depth of class 5 cavity is 0.75 to 1 mm. Point number 19, the tip diameter of number 245 bar is 0.8 mm. Point number 20, secondary retentive features are pins, slots, retentive grooves, skirts, coves and locks. Point number 21, initial depth of an amalgam restoration should be 0.2 mm into dentin. Point number 22, thickness of base in an amalgam restoration should be 0.5 mm. Point number 23, mercury to amalgam ratio should be 1:1, that is Eames technique. Point number 29, the higher condensation pressures are required to minimize the porosity and express mercury from the lathe cut amalgam. Point number 30, increased condensation pressure is required for lathe cut amalgam. Now here for lathe cut amalgam we got to use smaller condenser tip. Point number 31, decreased condensation pressure is required for a spherical amalgam. For this, larger condenser tip is used. Point number 32, phases of amalgam are beta phase, AGSN, gamma phase, AG3SN, gamma 1 phase, AG2HG3, gamma 2 phase, SN7 to 8 HG, epsilon phase, CU3SN, eta phase, CU6SN5, silver copper eutectic phase, AGCU. Thank you very much.